Speaking of sort of where healthcare is headed in terms of adoption, I think we have in the past few years, really since the rise of generative AI, seen sort of a massive amount of hype around sort of AI tools and their potential to transform healthcare. On the one hand, I think that's very much because these are amazing new tools that are available. I do also think there are some other market forces that are pushing leaders towards considering these new solutions that they may not have otherwise considered. And I pulled some data points on this slide to illustrate that. Overall, I think if you look at what is going on in healthcare today, you see that quality is becoming harder to sort of maintain. We're seeing increases in adverse events. Workforce shortages remain. This is been I could have put this on a slide each of the past 5-6 years, right? Like workforce shortages remain an issue. We're seeing inpatient revenue erosion, and we're seeing capacity concerns. And the reason I pulled these four data points is when you take them together, you're really looking at a set of issues where healthcare leaders are tasked with needing to potentially improve quality, um, have sort of like increased capacity concerns, don't have the staff currently to be able to solve some of those challenges, and are sort of losing, sort of getting tighter operating margins. So they don't have the easy ability to go hire more staff or to go sort of buy a bunch of new solutions in order to solve these challenges necessarily. So it creates this world where there's not a lot of money to solve the challenges, and there's really tough challenges without staff to do it. And in that world, I think the sort of shining light at the end of the tunnel in some respects can be a transformative technology like artificial intelligence, something that can support staff to accomplish some of these goals, to accomplish and solve some of your biggest challenges efficiently and with an ROI.